This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
And we're rolling, baby, with the Berman Method podcast. Dr. Jake Berman here with my beautiful co-host,
Jenni Berman, physician assistant.
And Walker Ryan down on the ground, curling some dumbbells right now.
He's curling for the girls.
Curls for the girls, baby. Good job, Walker. We are David going against Goliath. Goliath being the corporate medical system, big pharma, health insurance companies. They don't have your best interests in mind. They will choose profits over patient outcomes every single time because a patient cured is a customer loss. I mean, think about it. There's not a single pharmaceutical medication on the planet that doesn't have at least one side effect that requires another pharmaceutical medication to counteract that side effect, and so on and so on. And how many times have we both run into people that bring in their prescription list that is 3 pages long?
Right. And obvious interactions occurring, which is why they just keep adding more medications and supplements. And then they'll be like, well, they're just supplements over the counter that I'm having to add on. And I'm like, you're taking 4 supplements that are doing the same thing and probably causing more problems.
I can't tell you how many times you've come home and vented frustration when somebody brings in their medication list for the first time and you're like, they're on 3 blood pressure medications from 3 different doctors.
It's true.
It's like, what's happening? How come nobody talks to each other?
That's right. Or they'll get put on a medication and then they'll have to go on a different medication for acne, and then they have to go on a different one for their hair loss, and they're all 3 being prescribed by different physicians. And I'm like, why don't we just cancel all 3 of them?
And figure out what's really causing it.
Yeah. Where's the problem coming from?
So treating problems, not symptoms. There's not a single pharmaceutical medication that is geared towards treating the root cause. The one that we joke around about a lot on this podcast because it's on every single commercial is moderate to severe plaque psoriasis.
We just want to be as happy as the people on the commercials.
One day we know that we're successful if we're just half as happy as the people on a moderate to severe plaque psoriasis, or even the Crohn's.
Crohn's, ulcerative colitis, yeah. And it's not a joke. We shouldn't be laughing about it because these people, that have these diagnoses are in serious discomfort, and it is emotionally, physically draining. However, the reason we're quote unquote making fun of it is because the commercials tell you that you're curing a problem that might be better, 50% better in a year from now, but it has 36 side effects that you have to pay attention to or get through in the next year for you to be a little bit better.
Exactly. It's marketing at its greatest. If you want to see real marketing, take somebody that has an endless budget, like a big pharmaceutical company that has millions and millions of dollars to spend on marketing dollars. And look what they're doing. They're taking somebody that has this horrible diagnosis and then marketing it as they've got these happy people that are just loving life. And then in the fine print, it says, by the way, best results occur after 12 to 18 months. Mm-hmm. And if you do get those results, there's a chance that you're going to have to live with one of these other 11 billion side effects, one of which is death.
Right. Versus what we do in our practice is actually helping individuals reverse the disease and go into remission from the disease through their gut health, their dietary changes, really looking at where the problem is occurring, not just treating the symptoms. And many times they're much better than they would have been on the medication with much less side effects. And it often happens faster. than actually spending thousands of dollars on these medications and getting some results a year later. And by the way, you got to be on it forever.
You just had this happen last week.
I did. So we've talked about my ear issue that I'm going through a few times now on this podcast. And believe it or not, redoing my food sensitivities has actually improved my ear. So I went to dermatology last week and I'm like, they're looking at it and I'm like, it's actually much better to where it has been for the last 6 months. And I told them that I recently repeated my food sensitivities. They rolled their eyes at me when I told them that it was actually much better, but I was there because I had already had this appointment scheduled for several months. And then they tell me a diagnosis and give me a prescription medicine. And she said, these were her exact words: you have to use the medication consistently. Even when things start getting better, you're going to think you're better, but it's going to come back if you don't continue to use the medication, and you just need to stay on this medication forever. And I looked at her and I said, even though it's doing better without starting medication, since I went through my gut health and started focusing on food elimination, I should start this medicine and just take it forever, even if things are going well. She's like, yeah, it's going to come back. It's inevitable. So you just should stay on it forever. I was like, okay, ma'am, I have not picked up the prescription from the pharmacy. Anyway, that's my ear story. That's not what we got on to talk about today.
Oh my gosh. No. What I wanted to talk about is this new thing that we've mentioned a couple of times, StemPod, that has just been getting ridiculously good results. And it kind of ties into what we're talking about, because the thing that it helps the most with is diabetic neuropathy in general. And if you don't know what neuropathy is, a 5th grade reading level definition of neuropathy is the nerves in your lower legs start to essentially die for all intents and purposes. And it creates a variety of symptoms ranging anywhere from numbness, tingling, to intense burning and sharp pain. And it's something that you can't really get away from. It's one of those things where you go to the doctor and they kind of just shrug their shoulders up at you and say, try this drug, try this drug, try this drug. Well, it doesn't really help, but keep trying it. There's really no other option for people with neuropathy, diabetic neuropathy, any type of demyelinization or nerve-related issues. And this translates all the way into traditional nerve-type pain, like sciatica type things, where you're actually getting compression on the sciatic nerve, which creates that pain that shoots down the leg, and back pain. And even other pains up in the neck, the shoulder, tennis elbow, carpal tunnel type symptoms, where these are all correlated with nerve type issues. And historically, there's been no significant relief or intervention that directly affects the health of the nerve until StemPod. And it's literally the only unit on the entire market in the world right now who specializes in nerve health. And they've got this patented technology where they're the only ones that do it, or the only device that can do it right now. And it's essentially, here's another 5th grade reading level. It's essentially like rebooting the nerve. So if your computer is acting up, what's the IT guy tell you to do over the phone?
Turn it off and turn it back on. Unplug it and plug it back in.
Unplug it and plug it back in. And that is almost identical to what StemPod is doing to these nerves. And it is instantaneous relief. And it's lasting relief. So not only is it instantaneous relief for people with any type of nerve-related issues, but it's actually lasting. It's curing the problem.
Right.
It's actually affecting the nerve directly.
Right. Rebooting the nerve. And it's non-invasive. You haven't said that yet.
Non-invasive, doesn't hurt, might be a little annoying depending on how bad the nerve is. So it could be a little...
It feels like a muscle contraction. It's not the same, so don't get your panties in a wad when I say this, but it's very, in my opinion, kind of similar to having a TENS unit on, where you can feel the muscle contracting. It's by no means is doing the same thing as a TENS unit, but you can feel the muscle contracting that the nerve is innervating.
My panties are not in a wad after that statement because it is very similar to that sensation. But yes, you're correct. You can get a TENS unit for $10, $20 at CVS. You're not getting this.
Right. It's
unit.
not doing the effect that the stim pod is doing. It's not even, TENS units aren't even working on the nerve, really.
Yeah,
right?
They're just stimulating.
So, right. So it's a similar sensation to where it's not painful. Maybe just you feel muscles contracting, but it's not like a cramp feeling either. It's not uncomfortable.
It's a very unique sensation.
I would say it's less uncomfortable than shockwave.
Yeah.
That's my opinion.
Yeah. And you can say this because you've actually been doing it. You've had this chronic hamstring injury where it's very similar to sciatica. It's a nerve-related pain.
It is. Yeah. Goes all the way down my leg, sometimes to my ankle. Yeah.
Yeah.
So I recently started with shockwave first and then added in stim pod, relating this hamstring issue to having 3 C-sections and having essentially minimal nerve function. I don't even know what nerve it is, but the one that innervates my hamstring. I didn't have to remember all the dermatomes and nerves and all the things in my world. But anyway.
I'm glad you brought up C-sections because another little thing that this thing is ridiculously good at helping specifically women with is incontinence.
Overactive bladder incontinence, urge incontinence.
Yeah. Insane. And it's so simple and it's so quick. It's like within 8 treatments, the vast majority of people are fixed.
Right. And now even more research is being done on vagus nerve. Helping with the vagus nerve, desensitization of the vagus nerve.
Yeah, vagus nerve, anxiety. It's just insane. There's not a unit on the planet that has given us the excitement that this thing has given us. It's just crazy the amount of stuff that is legitimately helping with, not easing symptoms, but actually healing things, and people are getting lasting relief. I mean, the diabetic neuropathy is the big one. For years, you get diagnosed with diabetic neuropathy and they're like, well, sucks to suck.
Right.
Good luck.
Or take the gabapentin, which then makes you feel like a zombie.
Yeah. So there's got to be, every single person listening to this knows somebody that has neuropathy.
Well, and even better is potentially they can do it at home. They don't even have to come to the office. However, if you come to the office, it's what, like 12 minutes? Like max. Each area is
5 minutes max. It's 5 minutes per nerve or per location. And we typically don't do more than 2 locations in one setting. So 10 minutes, you're done with the whole thing.
But you could even potentially do it at home yourself.
Yeah, we've got rental units where people are renting them on a weekly basis so that you can do it at home. And the best thing about people taking them home is usually a spouse has something. So you're benefiting like a 1-2 punch when you bring it home. But anyways, the biggest reason why I wanted to bring this up is because we are all so freaking excited about this thing in the office right now that you've got to try it. You just have to try it. If you've got chronic pain in any way, shape, or form, chronic back pain, chronic neck pain, chronic shoulder pain, chronic ankle pain, you've got to try this thing. If you've got diabetic neuropathy, sciatica, carpal tunnel, anything related to nerves, you've got to try this thing. And the big one for you ladies out there, especially postpartum, especially C-section, with leakage, incontinence, not being able to, you say better words than me.
Yeah, pelvic floor dysfunction. But even just, me having 3 C-sections, just the numbness you have in the lower abdominal area is, it's nice to have that feeling back.
Yes.
That you haven't had in years. Yeah.
Carrie in her office, she had a lower leg injury and there was a part of her lower leg that was numb for years. She did 1 treatment and she goes, I can feel my leg again.
Well, she said, I can feel my pant leg. She had not felt her pant legs against her leg in years.
Yeah. Same thing with one of our other ladies. She had this foot issue where she described it as a numbness underneath her foot. It felt like she was walking on almost like a swollen fat foot. And it's just been like that for years. We did one treatment on it. She goes, I can actually feel my foot again. It's just a weird sensation for these people that have these chronic issues, because typically, I don't know, at least 30% of our clients that come to us for some other reason have something that they don't think we can help them with. Meaning you come for shoulder pain, but you've also got this foot numbness that you've been dealing with for years, and you don't think you can help or we can help you with it, so you don't even mention it. And those things are coming up more and more often, that because we're just using this thing on every single person that comes in now, because we're just exploring with it. We're seeing, what is this thing helping with? And it's literally helping every single diagnosis that we've played around with in the past couple of months. So to say that I'm excited about this thing is an understatement. This is absolutely insane technology, and we're the only ones in Southwest Florida that has it. That's the big thing. Tell me more. You're trying to entertain Walker right now, so bring it back in.
I was just going to say the only one in Southwest Florida. I mean, that's a big deal. And you could take it home.
You can take it home. We've got 6 units, 5 of which you can take home.
Awesome.
Do it by yourself. So we've got a big workshop coming up this coming July. I think it's the
18th, 19th. I was just looking at that on the calendar, actually.
18th and 19th. So Friday and Saturday, we've got 3 workshops because we're going to fill all 3 of them. Typically, I only do 1 workshop but this one's going to be so popular that we're going to have to do 3. So we're going to do 2 workshops on Friday, the 18th, and 1 workshop on Saturday, the 19th. And it's going to be 100% demo do on STEMPod. So we're going to be having people try this thing out, and you're going to feel the benefits within 5 minutes. It's almost instantaneous, within 5 seconds. But by the end of 5 minutes, you're going to know that this thing did something very unique, very special compared to anything else that you've tried before. And what we're looking for is the Friday morning before the workshop is I'm looking for some of the most difficult cases that we can possibly get our hands on, because we're flying in Dr. Collins, who is the front runner of STEMPod. He's getting close to being world renowned in this subject area, and we're literally flying him in to come do the workshops with us. But what we're looking for is 3 or 4 or 5 of the most difficult cases that we can possibly get our hands on, so that Dr. Collins can personally work on you the morning before our workshops get going. So if you have been struggling with diabetic neuropathy or sciatica, and it's just not gone away, or you know somebody that's been dealing with chronic, horrific neuropathy in some way, shape, or form, please, please, please call me, text me, email me, carrier pigeon, snail mail, smoke signal, whatever it is, let me know, because I'm looking for 3 to 5 people max to come in here and personally experience this intervention from Dr. Collins that Friday morning.
For free?
Probably.
Oh.
Probably. I don't know. Don't catch me off guard right now. Yeah.
Didn't know.
Yeah.
Okay. Sorry, I didn't know.
It depends on what the situation is.
Okay. What about the workshop, though? That's what I actually meant, is the workshop.
Yes. Workshop's free. Okay. Yes.
The workshops
free.
are free.
Yeah.
Okay.
I don't know about the actual treatment, though, because it's a significant treatment.
Right. I was asking, sorry, I was not clear. The workshops are free. The 3 to 5 to be treated beforehand is a different story.
Yeah, just give me a call, because I need to know the story. There's things that rule you in or rule you out for being appropriate for this opportunity. So super excited about this STEMPod, rebooting the nerve, getting ridiculously good results. If you're interested in this thing, call, text, email. This thing is insane. We're the only ones in Southwest Florida that has it. We've got 5 rental units that we can send out. We're not renting the 6th one. Obviously, we have to keep something in the office here. And it takes 5 minutes, 10 minutes max. It's insane.
Walker says, come try it. And you can see me too.
Yay!
I can do it too. If you haven't read the book, I Can Do It, you should read it. I can do it too.
Yep, that's one of our favorites at home. Good?
Awesome. Yes. Have a great week, everybody.
Send me those names. Refer somebody. Take advantage of this. 5 people max. As soon as the spots are filled, I'm not taking anybody else.
Ciao for now. Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.